Everybody is confused in treating diabetes. That's why diabetes is a constant disease where it evolves as humankind evolves. And all these things are defining the course of medications or the course of the action what we take for diabetes. And it's for much better understanding of what type of diabetes is and what we are going to deal with. If you're overweight and if you're pre-diabetic, if you reduce few kgs, then automatically your diabetes comes under control. But there are certain predisposing conditions which might trigger or which might indicate that you might become insulin resistant or diabetic in the future. But what we have to have in mind is once you are named diabetic, then you should always be cautious to think that you're always diabetic.
Hi, Dr. Bhagya.
Hi, Rashmi.
Welcome back.
Thank you.
And at the offset, I want to say that India today is the diabetic capital of the world, or at least it's close to being. Not sure about the statistics. This is a true pandemic, right? Diabetes across the globe. And it's something which is not addressed because it's something which happens over a very long period of time. And I remember I had read a statistics that number of people dying of diabetes every year is far higher than number of people who died in those 2 years of COVID. But still, there is no fear or there's no urgency around attending to the causes and the symptoms or the impact of diabetes. So tell me, doctor, about insulin resistance is supposed to be the first step of diabetes, or what are the types of diabetes?
No, diabetes, yes, you said it's a global disease. Diabetes has become, I would say, the number one killer disease when it was much lesser in comparison to the other diseases like heart diseases and cancer, which were having the topmost ranking when it comes to mortality. But nowadays, diabetes has picked up and it is rated as one of the major diseases for morbidity in not only in India but all everywhere in the world. The diabetes is actually a disease rather than a disease. I would say it's a lifestyle problem. Why would I call it as a lifestyle problem is because it's not depending on one factor which is going to cause. If you have a cold or if you have a throat congestion, then you could pinpoint and say it's because of a bacteria or because of a virus. And you can even come down to actually find out what type of bacteria is it and what type of medicines to give to kill that bacteria or to live with that or what to do with that. But everybody is confused in treating diabetes. That's why diabetes is a constant disease where it evolves as humankind evolves. And when medically, if you're asking me what are the types of diabetes, yes, as everybody knows, there is type 1 diabetes, type 2 diabetes, and we also call type 3 diabetes is there where it is combined with Alzheimer's. Type 1 is where the secretion of insulin is at risk. So it becomes an insulin dependent diabetes where initially we thought it was the diabetes of the young where it comes only in young kids and doesn't affect the adults and all those sorts. Type 2 is a disease where the insulin is there, sugar is also there, but the receptors are not working properly. So it becomes a secondary diabetes, we call it as. And there is another form of diabetes where there is maturity onset diabetes of the young. We call it as MODY, where the diabetes which comes usually on an elderly adult is seen in much younger individuals. And all these things are defining the course of medications or the course of the action what we take for diabetes, and it's for much better understanding of what type of diabetes it is and what we are going to deal with. Even before we quantify it as diabetes, there is a condition called pre-diabetes. Pre-diabetes is a state where it's a biochemical marker where we test the blood to see whether you might get diabetes or not. There are two forms in that. One is called the impaired fasting glucose, and the other is impaired glucose tolerance. As the name suggests, impaired fasting glucose is when the glucose level is when you're fasting for 12 hours, when your previous day meal for the next meal is 12 hours gap, and when you check your fasting blood sugar, it is more than 100 milligrams per deciliter. The values are not very constant as it varies from the WHO standards and the American Diabetic Association standards. On an average, in India, we'll keep it like that. If it is more than 100, if your fasting glucose is more than 100, then we can categorize you as a person who is suffering from impaired fasting glucose. The second part is impaired glucose tolerance, which means how well your body could tolerate the amount of glucose which you take, which is when we take a blood sugar after you eat, after a meal, which is about 1.5 hours or 2 hours window after you have a meal. we'll check your diabetic levels, and if the blood sugar level is more than 140, then we quantify you as impaired glucose tolerance. So these two are early diabetes or pre-diabetes, where we don't actually prescribe medicines or we don't actually treat you. We would advise you for a better lifestyle changes, modifications in your diet, exercise, and all those stuff. And almost all 90% of pre-diabetes can be reversed if there is a change in lifestyle. And I would even go to one step further and say, if you're overweight and if you're pre-diabetic, if you reduce few kgs, then automatically your diabetes comes under control. Pre-diabetes falls in place. But this is a clear indication that you are going to be diabetic at some point of time. The other important marker.
And what is the period? Like, after how long of being pre-diabetic do you?
Very, very unlikely that we could quantify it in terms of months or days or years. Some people might even go on pre-diabetic stage for months together or even years together, but suddenly they might become diabetic.
And if a person were to want to diagnose him, find out whether he's pre-diabetic or is he having disposition to getting diabetes, at what is the reason why he should go for a test to check?
The compelling reason is probably if there is diabetes which is running in the family. Even though I personally differ from this, I personally vary from this and say, if your father and mother has diabetes, you need not get diabetes. But still, what medically it is understood globally is that if your parents, if your mother and father are diabetic, then most likely you might become diabetic. So it's always advised to check your blood sugars. There is no hard and fast rule, or there is no symptoms or signs which would say you might become diabetic. But there are certain predisposing conditions which might trigger or which might indicate that you might become insulin resistant or diabetic in the future. One is weight gain. One is rapidly losing weight. When you're rapidly losing weight, then you are already diabetic. That's when you rapidly lose weight. Lethargy, we say, or fatigue, where you have a normal day of work, but you feel tired all the time. That could be a symptom of diabetes. Or if you're passing urine too much at night, or you're passing urine frequently, or you're thirsty very often, and you become dry in your esophagus, in your mouth and oral cavities very often, and if you're hungry again and again, you eat and then you crave for more sugar. These are all some of the basic symptoms which might indicate that you might go into a condition called prediabetes, or you might become diabetic in the future. But they are not all symptoms which directly indicate that you are diabetic. But if these predisposing factors are all put together, then it's better you get yourself checked to see if you're pre-diabetic or you're already diabetic.
Any other physical symptoms, doctor, which are visible to where a normal person can say, hey, I can see this, maybe I need to check?
The most common physical symptom is sudden weight gain or sudden weight loss. These two go hand in hand. Probably I would say if a person was very normal and then suddenly if they lost sudden lean mass or muscle mass and then they become very lean, then yes. The first thing what I do is to go and check diabetes. The second is polyuria, polydipsia and polyphagia, or normally what we all know, like you eat more and you're hungry again, and you drink water and you pass urine, you drink water and you pass urine, then probably you are in a diabetic stage. And then tiredness, weakness, or you're not able to do a job, you're very tired, you're very weak to even do things or walk, then probably you're diabetic. So these are the very alarming symptoms which might trigger that you might have diabetes.
Any skin discoloration?
Insulin resistance, yes. Insulin resistance, if there is acanthosis, like I said, acanthosis is a condition where there is black striations or strips which comes on places like your neck folds, your armpit folds, or your inguinal folds, or your hip folds. And these are the indications. And if you have skin tags, if suddenly there are lots of tags and the outgrowths popping up here and there, then probably your body is going into insulin resistance. And you might want to check your HbA1c's, fasting and postprandial blood sugars to see whether you're diabetic or not.
Is type 1 and type 2 diabetes reversible?
Type 1, if you can purely diagnose type 1, and if there is a problem with the islet cells, the beta cells, the insulin producing cells, and if there is a C-peptide chain problems, and if there is an amino acid issues, then very unlikely that the reversal is going to be very hard, and even it could be to an extent that it is impossible. Type 2 if it's an early type 2 diagnosis done, and if it is purely because of your lifestyle, and if the patient is really willing to change their lifestyle, food patterns, their physical exercise, or their pattern, how they manage their stress levels, type 2 is reversible. But what we have to have in mind is, once you are named diabetic, then you should always be cautious to think that you're always diabetic. Even though the blood sugars might come back to normalcy, but there is always a question or a comma that there is going to be diabetes hikes somewhere at some point of time in the life. So whatever you did to bring back that normal blood sugar levels should be continued and maintained for a longer and longer period, as long as you can do it. Then you could be probably not diabetic forever.
Would you say, doctor, that the resistance, again, the concept of family physician and the resistance for early diagnosis,
Yeah.
or just to, visit a doctor for a general consultation, is one of the reasons why so many people are getting diabetic, where they could have avoided getting there in the first place?
I see a very common trend, even when I practice, where I practice, is that there are two categories of people. There somebody who are very voluntarily wanting to see if they are diabetic. There is another category which absolutely shuts you when you say even to check a blood sugar. See, probably I'll give you an example. I had a patient last month when she came with miliary kind of rashes. There's a small, we say boils, in colloquial we say heat boils. The hair follicle gets infected, and so such kind of heat boils here and there at the back, and it comes and goes. And then I said, probably you might become diabetic. So I said, why don't you check your blood sugar? She was so adamant, and she said, no, family, nobody has diabetes. I checked it last month. I didn't have diabetes. So why do you want to check it? I even said, it's just going to be a small prick. It's not even going to cost you much. But she was very adamant that not to get her self-tested. And we waited for another month. Problems didn't go down, so I had to force her to take a blood sugar, and her blood sugar was 375 after food. So, and she was very repellent and said that, no, your machine might be wrong, your lab is wrong, and all those kind of stuff. So these two categories of people we still see. They think that naming somebody a diabetic, they think it's because of the pharmas, because of the doctors wants to make money. But science is always science. So like I say, science can be changing, but it might take another 20, 30 years for this science to change. Probably they come back and say that the 100 milligrams per deciliter of fasting blood sugar is normal. Now could become wrong in another 20, 30 years. But right now, whatever we know is to stick with these values. So if your body is not showing the right amount of value, then you have to name yourself diabetic. Then you have to sort treatments. The treatments are of different methods. Like whatever type of treatment you want to take is up to you. But whether you want to take treatment or not has to be discussed with your doctor.
You at least need to know whether you need to take a treatment or not.
Diabetes is one disease which I would keep in par with tuberculosis. Tuberculosis, as we all know, is a disease which can affect anywhere from your head till your toe. Very similarly, diabetes, I would say, can affect any part of your body, right from your skin to your eyes, to your kidneys, to your liver, to your pancreas by itself, to your lungs, anything. See, imagine most of the deaths which happened because of COVID were patients who were already diabetic and they didn't have a good glycemic control. That's because the response to those viruses are very dramatic, and the response to the medicines are all very low when diabetic patients. So we find it really hard to treat chronic other illnesses which comes in when you're diabetic. For example, ulcers. When you walk in and you get a small ulcer or an aberration in your feet, then it will escalate into a diabetic ulcer very fast. It will escalate into a gangrene within days. I have so many patients who come in and say they just had a small nail prick. It took 2 days, then how can it become so black in 2 days? So imagine the extent of bacteria which could come and create a gangrene in a diabetic patient rather than a normal individual. So being vigilant is more important than actually getting treated. There might be a stigma where it is already known that once you're diabetic for a lifetime. Once you're on medications, then you'll have to take medications for a lifetime. Yes, there are different schools of thought in this. There are different doctors who have different thoughts on this. Somebody might come back and say, yes, I can stop all medicines by giving some supplements or some herbal decoctions. Yes, I can come back and say I could go to natural remedies and then I can reverse diabetes. Yes, that is my opinion. That is my understanding. Somebody else can come back and say, no, 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 all those things cannot do. You'll have to take tablets like metformin, sulfonylureas. Accept that also. But the decision making for treatment is between you and the doctor. But to know whether you have diabetes is your right. And I would say it's by choice, not by chance. Because if you're diagnosed by chance, then probably you already have damage, then actually in a stage of by doing it by choice. There are organs like kidneys and the retina in the eyes. We call them as end organs. End organs are something it's very important to know that every patient should know it, I'd say. End organs are organs which has only one arterial blood supply. Arterial blood supply, to understand generally, are the vessels which take good blood to that organ. If we cut a small part here, then there are smaller blood vessels which grows like in the heart. We call it as collaterals. So most of the organs have collaterals and other forms of blood supplies, except for the kidneys or the nephrons and the retina in the eye. So we call them as end organs. So once there is a damage, when there is atherosclerosis, blocks, and if the blood doesn't go to that part, the nephron dies, the membrane dies, or the membrane becomes negative in potential, then there is no reversal on it. The same thing happens to your eyes. So that's why every patient, every diabetic patient or pre-diabetes or diagnosed with diabetes, you have to look into three important things. One is your eyes, one is your kidney, and the other is your feet. Your feet, why? Because if the diabetes goes into your nerves, then it numbs the nerves, then the delay in response to pricks or pains or hits or damages, so it causes ulcer and then it escalates into a gangrene. So every day when you take bath, you sit down, look into the bottom of your feet, front of your feet, in between your webs of the feet, and then you take time to look into it, wash them, clean them. And then when you comes to your eyes, see if there are any blurring of eyes or if there is any different patterns, like there are as if insects flying, or if there is a screen kind of deviations, or if there is a sudden shadowing of the eyes. All these things are very important to note. And when coming to kidneys, you see the amount of urine output, you see the amount of the color of the urine which you pass out, or the amount of urine, the quantity of urine which you pass to the amount of water you drink. So these three organs are important, where every patient can evaluate themselves rather than bringing it into a complication and then going to a doctor. So diabetes, that is why diabetes is important.
So, if I were to stop taking sugar and rice, can I say I won't get diabetic?
No. If you ask me, if apparently normal individual, I don't have diabetes, I don't have anything. If I eat 2 teaspoons of sugar or another cake full of sugar, I'm not going to get diabetes. But if my insulin is already low and if my diabetes is already high, say if I'm on a borderline, I'm crossing the renal threshold of 118. We call renal threshold is 180. Why we call renal threshold is 180 is because the kidney gets damaged if the blood sugar constantly is over 180. Imagine if you're already in 180 and if you keep adding it more sugar and more carbs, then your blood sugar is going to go, if it spikes. For example, I'll tell you, if you have, say, this is not the exact fact, I'm just giving you an example. If you eat biryani, which is made of rice, and if a bowl of biryani is going to cost or create an insulin spike of 50 milligrams per deciliter, if I'm 110 postprandial blood sugar and if I eat that 50 grams, then my blood sugar is going to go to somewhere around 160. I'm way within limits from damaging my kidneys or the eyes or any part of the body. Imagine you're on 180 and if you add 50 milligrams to that, you're already going to 230 milligrams per deciliter of blood sugar. So at that given point of time, your blood is going to hold 230 milligrams of blood sugar per deciliter, which is bad for your organs. That's why we always advocate to cut on carbs and sugars and glucose and fructose and stuff like that for patients who are already diabetic or pre-diabetic or in the verge of naming diabetic patients. It's not that everybody who eats sweets are going to get diabetic. These are all if you go one step further, we'll see. There is a cause and effect theory. what is causing the heat in the world, we would say it's because of the light or it's because of the sun. But what exactly causes that heat is something else, isn't it? I'm giving you a general example so that everybody is easily understandable. If I say the globe is getting heated, then I say it's because of the sun's rays. And I say all these ozone depletions and all these things, carbon gases and all these things are all causes. But what exactly is causing this global warming is the heat from the sun. Is the heat alone causing this problem, or what is causing this heat is what we go into the deeper understanding of the cause. So what goes into the sun is helium and helium reactions, chain reactions causes heat. Similarly, diabetes is not one unifactorial disease. Diabetes is a multifactorial disease. Like I said, your physical activity, the way you eat, your environment and your mental state plays a major role. If you ask me to name 1, 2, 3, 4, I would say your mental state is 1, your environment is 2, and the way you eat is 3, and what you eat is 4. So I'll give more importance to this rather than the other way around.
So, doctor, in line with what you just said, you're saying that a person who eats sweets need not essentially have diabetes at some point of time in his life, right?
Yes.
Does it mean that a diabetic need not essentially stop eating sweets or rice?
No, I think the interpretation is different here. I'm saying that all who eat sweets need not become diabetic, but all diabetics should not eat sweets.
So what can they include or exclude?
Yeah. So the problem with this is why I'm being so strict on not eating sweets or carbs. I mean, carbs is not absolutely no carbs. Is there are lots of myths and understandings about sugars. Refined sugars, somebody come back and say white sugars are bad, brown sugars are good. It's all no. Every sugar is the sugar. Even if it's white sugar or brown sugar, the form which the sugar is made and it is refined or not refined is the only difference. Everything is same. You add honey, you add rosemary, the maple syrups, all those things. Whatever is sweet is going to increase your blood sugar. Simple as that.
Essentially, a body cannot differentiate between one form and the other form.
It doesn't care. It doesn't even understand all these things. Liver understands, yes. But it's too trivial to go on to minor details and say this is fructose, this is sucrose, and this happens, this and that. You don't have to break your head all those things. Those are all for biochemists, doctors who are into all these things. As a patient, as a layman, very simple. If your blood sugar is within limits, you can have sugar. You can eat sugars. You can eat sweets rationally. If your blood sugar is already high, doesn't matter if it is 180, 200, I would say to avoid refined sugars or adding sugars on top of your diabetic levels. So what happens is if there is going to be a damage into my kidney or my brain cells or my heart cells, adding more sugar to it is going to cause more damage faster than doing it by reducing the number of sugars which you take. So the sugar molecules are very, very important when you are named diabetic. Your blood sugar may be within limits. You're on insulin, you're on tablets, you're on medication. Your blood sugar is 140. You have a fantastic record, say 6 months it's 140. Beautiful. Still don't take blood sugar. Still don't eat sugars. If without medications, without anything, your blood sugar is within 120, postprandial sugars, you're not diabetic. You don't have a very zealous or type A personality lifestyle. Your sleep is good, your exercise is fantastic, you have a fantastic and peaceful life. No harm in taking no harm in taking sugars or eating more carbs. But once you are diabetic, then I would always watch the amount of blood sugar, the amount of carbohydrates I take.
Doctor, is it true that having anything sweet on an empty stomach causes a greater insulin spike rather than having it after a meal?
Yes, that is very true. Your breakfast is the most important food of the day. So I would say we are most used to have a sugary breakfast rather than a savory breakfast. So that this could be very confusing. So what kind of breakfast is good, what kind of breakfast is bad, and all those things. If you want to drink or eat something sugar in the morning, then most likely you are going into insulin resistance.
This includes your 1 spoon of
coffee
and your tea as well?
Yes.
As soon as you get up? Because that's like everybody does that.
No, caffeine. If you want to drink a black coffee, yes. If you want to drink a black tea or a lemon tea without sugar, no worries in that. Coffee has lots of antioxidants. It's good for your body. It's good for your cells. It gives all these energy, and all those things are good. But the moment you want to add sugar to it, you'll have to think twice. I'm not demonizing sugar or carbohydrates in a very bad way. It is required, like I said. But are you in a state that you want to do that first thing in the morning? Then you have to think about it. Probably you wake up, you have a nice coffee. You're not craving, but it's a habit. You're having a coffee. You don't have to worry about it. Your blood sugar is fine. You can have a coffee with a spoon of sugar, no problem at all. You don't have to be too strict. See, I see a lot of videos and reels where everybody tells you to weigh the amount of food you eat. Biryanis, you divide into 3 halves, you eat that. You don't have to be too strict on all those things. Life is to taste all these things, to try and eat all these things. If you're cutting down on all these things at a very young age, then when are you going to actually have all these things? So there's no harm in eating that. As long as you don't have diabetes, your blood sugars are not high, you don't have to worry about it. But watching your carbohydrates, watching your calories is important.
So you're saying the morning cup of tea can be had at 11 o'clock after your breakfast instead of on an empty stomach when you get up.
That is a possibility because, like I said, the way you eat is also important. So if you have more fibers in your breakfast, and then you come back to proteins and fats, you can even have a sweetie snack after that too. Doesn't matter because the distribution of sweet or the glucose which is going to come from the sugary snack which you're having at last is going to be way less than when you're reversing the order. But more than all these things, more than all these dietary discussions and all these things, there is another important factor which has to be kept in mind for diabetes. I'll tell you at last. The same story holds good for your dinner or your lunch or however you eat your meal. You can change it into salads, you can change it into cucumber, carrot and salads, or you can even change it into zero carb salads, what some people call it. Zero carbs are probably, they would say, non-sweety vegetables like cruciferous vegetables, broccolis or cauliflowers, spinaches. All these things are all 0 calories, which means they're not going to give you much of a glucose spike. Still, you can eat it stomach full. You eat it to fill your stomach, isn't it? You won't have a satiety feeling. You want to eat full. These are good things to actually fill your stomach. At the same time, it helps you to reduce your carbs. But carbohydrates are an essential part of your diet and you have to take carbohydrates. But how much you take it and when you take it is important. So you rationalize your carbohydrates and then you take it at last, you're probably safe enough to not go into insulin resistance.
What about fats?
Fats are good, but it has to be very, very low in fats. It's not that something you put too many spoons of ghee and natural fats are very important. Like I said, ghee, butter, naturally occurring fats are much more good than all these refined fats. Like the oils which we take, more easily the natural oils like the gingerly oils or the olive oils are good. Olive oil I wouldn't say is good for India because our body is not used to olive oils, but still there's no harm in taking it. We have seed oils which are fantastic, like coconut oil, beautiful, virgin coconut oil, gingerly oils, groundnut oils, they're all beautiful oils. They're not refined. And doesn't matter you cold press it, you machine press it, but as long as it comes from that, you're okay to take it. Ghee is a fantastic source of fat, very good fat, and butter is fantastic. But all the other refined oils or sugars, you'll have to work about it.
And what about you just mentioned about testing your insulin.
Yeah.
So if I were to test if I'm diabetic, if I want
Yeah.
to keep myself informed, we do an HbA1c test,
Yeah.
right? So how do I interpret it?
HbA1c is, there are three important tests when it comes to diabetes. Your fasting blood sugar, your postprandial blood sugar, and your HbA1c. Your fasting blood sugar is the amount of sugar which is present in a given volume of blood at that given particular time where you have fasted for about 12 hours. And the postprandial blood sugar is the same amount of glucose which is present in that volume of blood at that particular time after 2 hours, about 1.5 to 2 hours of meal. And the HbA1c is an average value. HbA1c is the ability of the RBCs to cling to the glucose molecules which is present in your bloodstream on an average about 2 months and probably 27 days. So we call it as 3 months. So the 3 months average, we even call it as a 3 months average. It's giving you an understanding that how much amount of hemoglobin is glycosylated, glucose, glycated. So that's why it's called as glycated hemoglobin. So hemoglobin has hemoglobin is inside the RBC, and the RBC is a major part of the blood, and blood flows, like RBCs flows in the blood, and glucose molecules are there. The RBCs is kind of a sticky molecule. The blood glucose goes and sticks onto the RBCs, and then we actually calculate how much amount of, it's not that the RBCs get sticky, but it becomes heavier when glucose goes and attached to it. So we check it in 3 months time to see how much amount of glucose molecules are attached to your hemoglobin, to see how much you are carrying on an average of 3 months. Because fasting and postprandial blood sugars might be an indication to actually alter your diet or your medications, but 3 months average actually makes us understand whether your body is responding to the medications which you have given, or your body is able to reverse the diabetes, or your lifestyle management is able to give you a good result, is all understood by the HbA1c. The other important blood test, what I would say, is called the serum urea and creatinine. The urea and creatinine levels are nothing but the test which indicates the health of your kidneys. So these things would ideally be done every 3 months, but if they are normal, you can push it to 6 months once, and if it is still normal, then you can push it to every year. And it's mandatory that every year there is an ECG taken. And if you have other problems like alcohol or smoking or other lifestyle obesities and stuff like that, then it's always better to do a treadmill test once in a while to see if your heart is okay. And there's a fundoscopy, or you can just go for an eye exam with any ophthalmologist, or you can just go to a radiologist and ask them to do a scan on your eyes to see if there is a retinal problems, or if there is a bleed or stuff like that. Fundoscopy is fantastic to see if there's diabetic retinopathy. And these are the most commonest tests which we do for diabetic patients. Cholesterol levels, lipid profiles, we definitely do every 3 months once. And I would say if the lipids are normal, then probably you could push it every 6 months once. So this is the diabetic routine, what every doctor should do, every patient should know about it. It's even customary that patient themselves would go and ask them, the labs or the doctors, to do it, probably to be on a safer side once you're named as diabetic. But you don't have to stress yourself too much into it if you're non-diabetic. But if you're diabetic, then probably you'll have to do all these tests.
Long time diabetes or pre-diabetes, which goes undiagnosed, where would you first see the impact? Which organs would get hit? Like the eye, you mentioned, the kidney.
Eyes and kidneys are the first to see. Eyes and kidneys are the most important organs I would see as a diabetic person. If anybody comes with undiagnosed diabetes, newly diagnosed, I would even recommend to say that any newly diagnosed diabetic patient should get their eyes and kidneys checked. And kidneys, it's very easy. It's not going to cost you too much to do a urea creatinine or blood urine nitrogen or a urine complete for that matter. A urine routine would give us a lot of information to see whether there is protein loss, whether there is sugar loss in the urine, because they are all substances which need not be present in the urine. Sugar and proteins are not substances which are normally present in the urine. So probably you go and give a urine sample, and then if you see sugar and proteins in it, then it indicates that the membrane is getting damaged. They are all positive and negative geared. The membrane is kind of a sieve, like where we use it for our flour, the kind of a sieve where it actually measures the specific gravity of substances which comes into the bloodstream. And if it is negatively charged and the membrane is negative, it pushes out. And if it is positive, the membrane is positive and pushes back into the blood. But if the membrane potential of the glomerular membrane changes, then it pulls the blood sugar into the urine and pulls protein into the urine. And that's when we call the membrane is getting damaged. And the other important diagnosis is an ultrasound. The ultrasound is very commonly done diagnostic test, which is non-invasive, which is not going to give you any harm, and it gives a lot of information to a doctor. Probably when you go for an abdomen ultrasound, they think about the liver, they'll see how big is the liver, whether the fat is there present in the liver, whether the liver is coping up with the blood flow, and then see the size of the kidneys, the color of the kidneys, which is whether there's a differentiation between the cortex and the medulla, and all these informations are very valid information for the doctor to see how well you're progressing with the disease. So newly diagnosed diabetic patients definitely will have to take these tests.
What is the one alarming, ignorant aspect that you would like to address that you observe among most of your patients with respect to diabetes?
Yeah, this is where I wanted to emphasize my understanding about diabetes. All these years, what I have studied, what I have done in practice, and what I am seeing is diabetes is not a disease which is purely physical. Diabetes is a disease which is purely mental. I could even say diabetes is a mind made disease rather than a man made disease. Man made disease, why I insist on man made disease is because we talk about carbohydrates, sugars, and stuff like that. And if you ask me, what is this mind made disease? When a person is in a form of a conflict, or when a person is in a stress which is not giving you a clear answer, you would probably go into diabetes. Imagine, not every obese patient is diabetic. Not every patient who is not eating properly is a diabetic. Not every patient who is eating sugars are not diabetic. But every patient who is emotionally disturbed in any given life circumstances, when they are not able to make a decision, when there is uncertainty, when there is one foot inside and one foot outside. I'll give you an example. I theorized this for a very long time, and I have proven this right in every single instance. You probably work in a finance sector. You probably lend money to people, and you're very uncertain whether that money is going to come back to you or not. If that keeps you awake at night, and that keeps you thinking at the back of your mind, you're going to get diabetes. Every patient who is diabetic can relate it to themselves. I'm giving you one example of a circumstance. Probably you have an interpersonal relationship problem. You don't know whether this problem is going to solve or whether the problem is going to be persistent. You'll get diabetes. You lend the money, you don't know if he's going to give it back or if he's going to run away with your money, you're going to get diabetes. You're working in an institution, you're working in a company, you don't know whether you'll get a promotion or you'll be left out, you're going to get diabetes. Why I'm insisting on this particular emotion is that I see in every case that if there is a turmoil, if there is a problem in understanding or uncertainty, that patient is going to always be on a constant stress level, which keeps them going. So they need constant energy to keep themselves running. Even when you're sleeping, even when you're idle, your body keeps running. So you need energy for this. That energy comes because of blood glucose. So this is the first and the foremost mental condition which would cause diabetes. So anybody who is like coming up in life, if somebody wants to make big money, big themselves into any field for that matter, that's uncertain. You don't know whether you're going to become famous, whether you're going to become a star, or whether you're going to shine in your field. If it is uncertain, if you're constantly thinking about it, then it's going to cause diabetes to you. Yeah. Exactly. Exactly. The diabetes happens, say, probably 6 months after your emotional instability. So if there is somebody to help you out of that emotion, if somebody is there to guide you out of that emotion, it need not be a doctor. It can be your family member, it can be your parents, it can be a wife, husband, anybody who is very close to you. If there is somebody to guide you and say, you don't have to worry about it, we are there. That's when your mind clears that instability, clears that uncertainty, and then you're out of diabetes. But if that emotion stays at the back of your mind, even if all these things happens, you're going to be diabetic for life. Irrespective of whatever cause we find out, irrespective of how much ever research we do, we can talk about peptide chains, we can talk about receptors, we can talk about failures, we can talk about liver not converting into glucagon. All these things are, yes, they are all medically proven scientific facts. But there is one important fact, which is the mind on top of all these things. So if your mind is at peace, you'll not get disease. And diabetes, yes, it is a mind-made disease. And mark my words, it could be another 10 years that everybody is going to talk about this and say, no, it's because of your mind. But now, right now, if we say it's your mind which causes diabetes and not your body. So if you are able to be, you can be in a very stressful or very uncertain situation, still keep yourself calm. if you're not worried about the result, if you're not worried about the end, if you're not worried about it, all these turmoils, all these things will be there, but you'll not be affected because of this. You'll not get diabetes. If not, you can write it now and then piece of paper and close it and say you will get diabetes at some point of time in your life. But if you're able to handle this emotion very well, it's something like you play a match of cricket. You don't know the outcome. It depends on many other factors. It's not that one person who is going to play and win the match to blame yourself. It is involving so many people and so many factors in it. Are you in a position to control the outcome of the game? Very unlikely. Very unlikely that you're going to see whether you're going to control the outcome of the game. So there are certain things which you cannot control, but you can prevent. So how to prevent it? Don't lend money. I'm saying for an example, if you have already lent money, and if you're worried if it's going to come back or not, you're going to be in a turmoil. Either you shut that door off and say you don't want about it, you're not worried about it, you're peaceful. If circumstances, you're worrying for circumstances which you cannot control, then you're probably going to diabetes. But if you have made an effort and if you have given 100% of your effort, still the outcome is bad, if you're not worried about the outcome, it's not going to cause any problems to you.
This has been an amazing conversation, doctor. I mean, the fact that you said that diabetes is a mind-made disease, it just brings into perspective as to why everybody says stress management is so important.
Yeah.
So it's been great. I mean, thank you.
Thank you very much for allowing me to talk about this. It's because it is something which is very less spoken about, but everybody knows this. Everybody actually has it in their mind, but they don't know how to bring this out. Even if I understood that if somebody is struggling this, but I should find a way to bring them out of this problem so that they are out of diabetes. Even though I'm saying all these physical and environmental causes are there, if you're in peace with this environment, if you're at peace with yourself, disease is not going to affect you. So everybody has to retrospectively think about themselves. Even you're diabetic, you can reverse diabetes if your mind is clear. But we don't know the way to do it. We're not saints or we're not practices to say you have to do this, you have to do that. But you yourself is a saint for you. So you can evolve into yourself and then you can retrospectively think of how to come out of the situation. Once you're out of the situation, you can be 101% out of diabetes. But it has to be proved. Of course, I understand it has to come out with an effect, but self-realization is the best realization. So you work on yourself, you will be out of diabetes.
Thank you, doctor. And I can't wait for our next interaction to discuss another exciting topic.
I'm waiting. I'm happy to express my understandings about diseases, even though it's not a very long experienced practice, but there are certain things which everybody should understand, and thank you for giving this way to express myself freely. Thank you very much.